Hi, I'm Norziha, and for question number 1, as in for station 1, for 1A, to demonstrate the subjective assessment. So the question for station 1 is a 45-year-old housewife complained of right side of low back pain. Her pain is radiating to the right leg, especially to lateral calf, and cramp like after 15 minutes of morning walk. So for the question 1A assessment, subjective assessment examination. So for subjective assessment, first and foremost, we know that through a subjective assessment is where we evaluate, or we get the patient to describe her signs and symptoms, her major complaint. So as she mentioned, her major complaint is pain, and first we need to know where the exact location of her pain is. So as she mentioned, it's her low back pain radiating to her right calf. So and then we also ask, is there any other anywhere that she feels the pain? If not, we need her to describe how she feels, like how the pain feels. Like, is it a aching pain or throbbing pain? When she's feeling the pain, we need her to describe how the pain feels. And also we need her to tell us, to describe to us the intensity of her pain. For pain intensity, we can also use NRS, and then the numerical pain rating scale, and then it's this scale is a 0 to 10 scale, where 0 is the least or no pain at all, that she doesn't feel any pain at all, and 10 being the worst pain. And then we can also ask her, like, what position or what time does the pain feels the worst, or like what is the aggravating factor for her pain. And then with whatever the aggravating factor that she describes, we also ask her how does she manage her pain, meaning that how does she relieve the symptoms when she feels it. So is there any specific position that she because if she says like she's like after 15 minutes of walking, so how does she manage the cramp? Does she sit down? Does she take a break or rest or sleep, or does she take any medication to relieve her pain? And then we also have to ask her about her does this pain affecting her daily life? Does it affect her sleep? Does it affect her mood? How does the pain affect her work? Or if she takes care of the family, does her pain affecting her family also, or her sex life? That's all we need to ask the patient to describe to us, so that we can as a therapist, we can gather as much as information so that we can help her manage her pain better. So and then we can also ask her about how does she feels about the pain, in terms of is she worried about the pain in the long term, in the long run? Does she sometimes because if the pain is affecting her work, so maybe she's worried that if she feels this pain much more longer, then it will affect her economically, or she cannot go to work, or what. That all these we need to assess during the subjective assessment. And then the second one, 1B, is for the objective assessment. So for objective assessment, or physical assessment, first and foremost, we need to assess her general physical, as such as her posture. Does her pain affecting her posture? Does she have abnormal posture now? we need to assess her posture, also her gait, because she mentions that the pain is radiating down to her calf. So does it affect her gait? How's she walking now? Like, she limping or not limping? And when she's limping, she's stooping. So those kind of things that we need to assess generally first, and then we also need to assess her pain specifically again, because her main complaint is pain, so we need to really assess her pain. So in the objective assessment, we can also assess her pain through VAS, also the visual analog scale, and then we can also use the McGill pain assessment, or McGill pain questionnaire. So this kind of specific pain assessment can also help us to manage her pain, and to help her manage her pain. So and another thing is, we also can assess her, her her musculoskeletal pain, musculoskeletal assessment, as in is there any weakness that she's feeling, like is the pain is making her affected leg weaker than compared to the other. And then we also need to assess whether there is a neurological factor affecting the neurological examination, or any paraesthesia that she's feeling, or any sensory loss on the affected limb. And then we also need to assess her reflexes, so we can demonstrate, we can examine this by for muscle weakness, we can assess her, we can assess her muscle weakness. You can see how her through muscle strength. And then also we can do SLR to see whether is there any aggravating of symptom during SLR. And then, as I mentioned, reflexes also, we need to check her reflexes, because sometimes pain does cause weakness and loss of sensory and all. And then because it's on her low back, so we are afraid that it might interfere with some of her somatosensories. And then we also need to evaluate her psychological, we need to do some psychological examination. This is just through questionnaires, or how she perceived the pain. We can ask her, like like how does she, like her knowledge of pain also we can assess, so that we know how, like how she is taking this pain, or is there any other psychological factor affecting it. And then and we also need to know, like, how the level of her level of pain knowledge, so that all this assessment can help us to manage her pain better, and then so that managing her pain does not just come from us, that she also needs to really understand, like, how and what she's feeling. For station 2, the question is, a 54-year-old woman has 8 years history of lower posterior cervical pain and left upper extremity numbness and tingling. Her pain has been continually growing worse, and she had failed attempts at conservative management by her physiotherapist. So for question 2A is pain education. So because we know that she had failed her conservative management, her conservative physiotherapy management, so we need to take a different approach to managing her chronic pain. So that approach that we want to introduced to her is through pain education, where the goal of this pain education is so that she can cope with her chronic condition, and it provides her with better knowledge and information about her pain or her condition, and how she can able to manage it. So through pain education, we will provide her with or facilitate her with pain knowledge, and through pain knowledge she will understand better about how her condition is, and she can like can make her believe, or make her believe that her condition, her chronic condition, is not something that is threatening. And then through pain education also, we can also educate patient about the pain neuroscience, and so that patient can gain knowledge in that area, so that they can understand better and they can manage better of their chronic pain. So this type of pain education is it's a biopsychological approach, where we need the patient to see their condition as of like a normal, neutral, non-threatening condition, so that it doesn't stresses the patient out, and also it doesn't doesn't give her other adverse effect from this chronic pain. So for question 2B, pain intervention. So as we know, this patient has failed her conservative physiotherapy management, so we need to take a different route or different approach to managing her pain. So what I propose is through cognitive behavior therapy, where CBT is an intervention that seeks to enhance patients' control over pain through psychological technique. This CBT technique is a therapy that notions patients' belief, patients' behavior, and also patients' attitudes, towards the pain, and how these notions play an important role to determine their overall experience of the pain. So because we want the patient to see the pain as a very non-threatening thing, so we need to we need the patient to develop these cognitive and behavioral skills, so that they can manage their pain better. So there are a few steps to CBT, which is sorry. First, we need to teach the patient about the specific skills, about the specific cognitive and behavioral skills, for better management of pain. And then we need to inform patient regarding the effects of these notions, where we need to inform the patient about the attitude towards the pain, and how emotions can play an important role, as in emotions like fear of pain, and then how they believe the pain is, and then how the behavior can have effect on the pain. And also we need to emphasize on the primary role that the patient can play in managing and controlling their pain. Okay, because it's a psychological technique, we need the patient to to also adapt to this pain, and then so that they can have a better management of their chronic pain. So CBT has been proven to have a very successful rate at managing chronic pain in patients, and um, many patients with chronic pain will definitely benefit from this type of therapy. Thank you.